My name is Gigi. I'm from St. Paul, Minnesota. I'm 57 years old. I was diagnosed with high-grade serous endometrial carcinoma, which is also HER2 positive, and I'm stage 1A. And then I am a mother of three and a massage therapist full-time and a musician part-time and a crocheter to keep me sane. So, and I love learning and I love teaching. My first symptoms were actually kind of a little bit of a mystery. They were not necessarily typical. My first symptoms were, they felt like hiccups behind my sternum here. And they were happening like after I would go and pick up garbage in the neighborhood or bend over and stand up. And I also my guts were a little off. You know, they just weren't the Goldilocks like they had been. They were either a little too soft or a little too hard and just not quite right. And the things that I would normally do to get them back on track were not working. And then I also had some spotting that went along with that. But the spotting and the gut stuff kind of went hand in hand. So when the guts were really acting up, the spotting was heavier. And when the guts were calmed down, the spotting was less. And I thought, well, maybe it's a hemorrhoid because, you know, that would kind of make sense. And so cancer just like never was on my radar. I thought I was dealing with maybe a vascular issue or maybe a vagal nerve issue. I went to my primary care, who is this great nurse practitioner. And I said, okay, I'm not in distress. I'm not in pain. You know, my blood pressure's fine. My pulse rate's fine. My oxygen is fine. I'm not running a temperature, but I have this trio of weird symptoms. Can you help me figure them out? And so he said, well, spotting, we're going to do a vaginal ultrasound. And for this stuff, maybe it's cardiac, maybe not, but let's do a heart monitor and, you know, I'll run some other tests. And at the time, they found that my magnesium was high. So maybe we thought, well, maybe that was why the guts were off. So I stopped my magnesium. And then we did the ultrasound right away, and that showed that there was a thickening of that endometrial lining. And so he said, yep, time to go back to your OBGYN. But the biopsy from the OB-GYN then showed this serous endometrial carcinoma with an HER2 positivity, also PGR positive and ER negative. And so then my next stop was the oncologist a couple of weeks later. And she took a look at that and said, yeah, we should really take care of that as soon as possible. So then I had surgery probably about a month after my diagnosis. So everything just happened really pretty fast. And then the surgery confirmed, you know, a lot more about it, the staging, and then the other tumor markers that were and were not present. So I'm thinking, oh yeah, this is just one of those uterine cancers where they just take the uterus out and it's not a big deal. They're slow growing. They don't tend to metastasize. They just kind of stay put. No big deal. So I'm watching my husband's eyes actually get bigger and bigger and bigger as I'm on the phone with this gynecologist. And so first I had to calm him down, and he's like, did I hear cancer? And I'm like, well, yeah, but I don't think this one's a big deal. And he's like, are you going to be okay? And I'm like, do I look afraid? And he's like, no, actually you don't. And I said, that's because this one's not a big deal. So that's what I thought going into it. And the ironic thing for me was, as soon as I got done kind of calming my husband down, the first subconscious thought in my head, because I tend to be a little bit of a workaholic, and just coming off of so much work just to run a massage therapy business during COVID and everything. I mean, I was up till 10:30 every night doing laundry. So my first thought is, oh, good. I get to take a break and no one will be mad at me or blame me for it. And I look down at my abdomen. I go, uterus? This is about a vacation? I didn't quite understand what I was up against at that point. I didn't know about the different kinds of endometrial cancers. And so I had a slightly later conversation with one of the other OB-GYN friends, the one who'd actually done the biopsy. And I said, well, this is what Dr. Hallman said. And Dr. Les was like, yeah, maybe you want to pay attention to that word serous that's on there. It took a very long time for my labs to come back after the surgery, which may have been a little indicator that something was a little different and special. It took like 3 weeks. I was blaming it because it was over the 4th of July weekend. I'm calling the nurse. I'm like, you told me 4 to 7 days. And she's like, yeah, we don't have them yet. And about 3.5 weeks later, they finally came in. And I saw, oh, good, 1A. I'm really early. That means I shouldn't have to do anything more. And when I talked to the oncologist nurse, and she's like, yeah, Dr. Thomas Pepin wants to see you and talk to you about chemo. I was like, what? What do you mean chemo? I caught it at 1A. This is really early. She's like, yeah, but all it takes is one little cell. Even though my lymph nodes all came back negative, my pelvic washing came back negative, my omentum came back negative, my ovaries and fallopian tubes came back negative, everything else but the inside of my uterus looked normal and healthy. Anyway, talking to the nurse and her saying that the oncologist wants to discuss chemo was the very first time it was like, whoa, what am I up against? What did I miss in my deep dives into what serous endometrial carcinoma was? What did I miss? And what I missed was research that kind of doesn't exist. So I wasn't really missing it. It's just that I wasn't necessarily represented in the research that was out there. So actually, I am part of a clinical trial because of that. I signed up to be part of a clinical trial in order to add to the body of knowledge. So I'm in the control group, so I get the standard arm of care. But when I was told that I was in the control group and I thought I would be disappointed, no, my little subconscious was like, oh, good. That'll be fewer chemicals to have to detox from. I had a radical hysterectomy where they take out the uterus, the fallopian tubes, the ovaries, and the cervix. I also had 12 lymph nodes that were sampled from a variety of places in my abdomen, not all in one place. This is different from like breast cancer where they take them all in the axilla. Mine actually came throughout the abdomen. And then I was told I was going to have an omental biopsy. But what I didn't understand at the time was that an omental biopsy meant they were going to take the whole greater omentum. So I didn't do chemo the normal way, but because I was part of a clinical trial, I had to make sure that it was compliant with the clinical trial. When they said chemo, and they said carboplatin and paclitaxel for 6 rounds, spaced 3 weeks apart. And my first response to my oncologist was, okay, but I'm going to do fasting with each chemo. And she said, okay, but you can't lose any muscle. And I said, okay, I think I can do it with something called a fasting mimicking diet where you get calorie restricted but optimal nutrition and you do get some support for those healthy cells. I'm just looking into it. I promise I won't do it if I start to lose too much weight or if it doesn't seem to be working. So I actually got a special scale that ran a little current through me and supposedly gave me muscle mass and BMI and visceral fat and all these other things besides weight. And I can't remember. I think that might have arrived actually after the first chemo. I did work with a nutritionist as well with chemo number 1, which was actually my worst chemo. I did do a boxed kit called Prolon because I was in information overload at that point, and it's like, I can't think. This one's pre-boxed. I'm just gonna do it. And actually, I felt really too good while I was on it. I'm like, I'm supposed to feel depleted and tired, and I actually feel really good. Maybe I'm getting too many calories. And I was supposed to go into ketosis, so I had those little strips that test for ketones, and said I wasn't in ketosis. I'm like, okay, I'm skipping dinner. I need fewer calories. I gotta be in ketosis when I go to chemo the next day. So at chemo 1, when they do the paclitaxel first and the carboplatin after, and that's after they give you an infusion that takes a little over a half hour of the pre-med. So the dexamethasone, which is, I think I said that right. That should be an anti-inflammatory. And then there's a bunch of anti-nausea things and antihistamines that they throw into that little cocktail. And 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 then they started the paclitaxel. So I put in my little earbuds. I had my hypnotherapist make me a special tape for chemotherapy just so that I would, work with the chemo and help the chemo target the cells that were bad and ignore the cells that were good, and, and help my body, process whatever was going through. My face was red and a little puffy, and I just felt dry and itchy and yucky kind of all over. And I had like a little nausea that next night. That was when I actually started to reintroduce a little more food. And, but I took the nausea meds, and that went away. The third and fourth night after my first chemo, I ended up actually with a lot of bone pain. Felt like somebody kicked me in the shins really hard all night. And it was mostly the nights. And so when I got to chemo 2-3 weeks later, I was actually feeling really quite good. By then they had added gabapentin because I was having like some restless leg syndrome. So I was taking that at night. Chemo 2, I did a different plan, the one that the nutritionist and I had come up with. Had fewer calories, still 4 days. It was about 500 calories a day of plant-based, higher protein than most of the fasting mimicking diet stuff says. But we did the protein because I promised my oncologist I wouldn't lose muscle. And so far I hadn't. And so I go through chemo 2, and they lowered the paclitaxel just a hair. And actually, I did really pretty good. In fact, so much so that I went back to work. But otherwise, I had no nausea, no vomiting, no diarrhea. I had no fatigue, which if you look at the studies on the few studies on fasting mimicking diet that have been done with humans, that is actually what happened. That was the fatigue, the nausea, the vomiting, and the diarrhea that were all really minimized. But what was exciting to me was my blood just it would recover faster. And so I never really dipped down to a point where I had to either delay a treatment or take additional medications or anything. So that was really encouraging, that my blood was showing that I was just doing better. I wasn't as depleted. So funny story. I'm such a type A person, and I love learning, and I'm home feeling good, bored out of my gourd. So I'm signing up for every webinar, online massage class I can find. So between chemo 5 and chemo 6, I found this great online class for manual lymphatic drainage. I've been trained in some other lymphatic stuff, but not the VOD. I'm like, cool, I can learn this technique. So I am taking this online class, practicing on all my classmates, me, myself, and I. And I'm doing all these, very gentle techniques, just kind of practicing. And I get to chemo 6. I'm like, oh, I better stop. I don't necessarily want to inundate my liver and my kidneys with too much stuff. And I know that this kind of speeds up the detox process, so I'll just stop. So I didn't do any manual lymphatic drainage until maybe a couple of days later. But I will tell you that when I woke up after chemo 6, I felt really good. I was expecting chemo 6 to be the worst. And it was definitely not. In fact, it was easier than 3, 4, 5, and 1. And I thought, there were a couple of other things that I did differently between 5 and 6. But I thought, I bet it's the manual lymphatic drainage. So a couple of mornings later, my face is a little pink. It's a little puffy. I'm feeling a little, windburnt. I'm like, oh, there it is. So I do a little bit of the manual lymphatic drainage, on myself. And within an hour, it's all gone. I'm like, oh my gosh, this stuff is magic. And so I probably, in hindsight, should have used a little more caution just doing it on myself, because I was actively in a treatment, and there's just not research on lymphatic during chemo as far as I know. But it actually was a happy accident for me. The clinical trial that I am part of is for, I believe it's specifically serous endometrial carcinomas that are also HER2 positive. And the trial was to try to determine, so there were 3 arms of the trial. One was the control group, which I'm in. So just regular standard of care. You get your six rounds of carboplatin and paclitaxel, and then if needed, any radiation afterwards for cleanup. And then one group got Herceptin along with the chemo, and then also for another year afterwards. And then the third group got something called Phesgo, which is a new kind of Herceptin. So there were actually 2 different drugs being trialed at the same time. And what they wanted to see was whether or not adding these additional HER blockers was going to improve the outcomes for the serous endometrial carcinoma, because it's a lot more like an ovarian cancer. It tends to recur pretty regularly, apparently. I guess what the interesting thing to me is I think they were initially looking for about 560 women or so, about 30% for each group, so about a third in each group. And they were trying to get these women from like 260 clinics across the country, which means that they only expected 2, maybe 3 women to qualify to be in this trial. So that's even just a pretty low number right there. But that tells you kind of how unusual the serous that's also HER2 positive. What I didn't say is 85% of most endometrial cancers are the adenocarcinoma, and you just take out the uterus, you're done. Another 5% are clear cell and some other things. They tend to be a little more aggressive. And like the serous, which is about 10% of the endometrial carcinomas, they tend to act more like ovarian. Of that 10% of serous, only 30% of the serous ones are HER2 positive. So now I'm in like the top 3% of my class. And then my particular tumor, which had some interesting markers and was 25% mixed undifferentiated cells, that's a little higher than the average too. So I'm like in the top 1 to 2% of my class, for cancers. So that's partly why I was having such a hard time finding information. The chemo ended, and really, I felt pretty good. I was able to go back and work and do full-time massage therapy and be a musician really throughout the whole process. My blood has recovered pretty much to back where it was at this point. So I am now 6 months out from chemo. I have 6-month hair, which is like crazy toddler hair, doesn't do a thing. So we disguise it with bunny ears. I'm feeling really pretty good. I get CT scans every 9 weeks, which is more than usual. Usually it's every 12 weeks, but because of the clinical trial, there's some things that they're following a little more closely. So I get CT scans every 9 weeks for a little while. I had an echocardiogram, which is not typically part of a cancer journey, but that was fascinating too. I was like a good peek inside of my body. Especially one where they don't actually have to go in and cut anything. And then, so my follow-ups and labs are every 12 weeks. And so far they're looking good. I do have a couple of mysteries. So a couple of my symptoms have come back. So like the guts are back to being weird and the little hiccups are back to being weird. It sure looked like the chances for recurrence were greatest between about 9 months after diagnosis and about 18 months after diagnosis. And so I kind of put her on the spot. I said, how long do I need to be no evidence of disease? How long does Ned have to be my friend before I can have my little bowl of ice cream and my glass of wine and celebrate going back to kind of a normal risk level and not feeling like I'm going to set myself back? And she said 12 months. I said, is that 12 months from diagnosis, from the end of chemo, or is that 12 months from today? And she said, 12 months from today. I said, okie dokie. So I have to stay the course for another 12 months and be really vigilant. And I have to figure out if there's something driving the inflammation here. Were my guts off before and not fixed by doing the chemo and all the cancer treatments because that was an inflammatory thing that set me up for cancer? Or was it something that was just kind of happening alongside and not part of the cancer? Because obviously treating the cancer did not fix the gut issue. Getting that no evidence of disease seems like, that's the pinnacle, that's the highest thing, but it's really a glass ceiling because it looks like you've reached the top, but really you haven't, because it's not actually a measurement of health. It's just a measurement of evidence of one kind of disease. So it doesn't mean that I'm healthy and I don't have more to try to achieve in order to get better and healthier. So I've been focusing on what can I pull out of these labs and these CTs to help me watch my own health get better and better and better. Every time, I have blood drawn or I get an imaging of my insides. As an oncology massage therapist, I certainly have a greater understanding of what it's like to look in the mirror and see somebody who doesn't look or feel like yourself. That's a weird thing. And nobody talks about that either. For 6 months, I'd look in the mirror and I would see my grandpa because I was a spitting image of my grandpa without any hair, and now at least I don't look like my grandpa, but I still don't quite look like me and I don't quite feel like me. And so there's still this kind of interesting disconnect, but I can now tell people about that. I've been reading quite a few books on feisty patients and how it's the feisty patients that end up being the ones who survive, the ones who say, these are my decisions. It is my body. That my care providers are on my team, but they're not necessarily my one and only coach. They're really on my team, that I'm actually kind of the CEO of this process as much as I can be in charge. But they are, my care providers, thankfully, are really highly respected consultants. And they say, here's what I think you should do. And they let me go home and do the homework and come to my decision, which is often, yeah, I agree with you. I think that is perhaps the best way to go, but then it becomes my decision. And I've already told my oncologist, sorry, not sorry, for being kind of a feisty patient who gets in your face and asks you really hard questions and challenges you. You want to do what to my omentum? And so I guess I would be as informed as you can be, but also know that you have to kind of let go of control. I know I have a lot of control issues and I like to be on top of everything and predictability about everything. I mean, that's why being told that I have to clear out my schedule for 6 chemo appointments and all these CTs and what? I have to, you mean I can't just schedule them when they're convenient for me? No, I can't. And so letting go of expectations, but also being feisty.